Hello, this is Charles Epstein, host of the Catalyst podcast. Today I'm joined by Dr. Michael Giles, a licensed psychiatrist who founded Sonara Health during his residency at UT Southwestern Medical Center. Sonara is committed to facilitating humanized, compassionate, and trustworthy interactions between opioid treatment program patients and providers via a remote dosing solution that makes it easier for people with opioid use disorder to commit to their methadone treatment programs so they can get their lives back. Michael, thanks so much for joining me. How are you?
Doing well. Thanks for having me, Charles.
Yes. Even during your residency, from what I gather from our initial conversation, you never intended to practice medicine, in your case, psychiatry specifically. When did you make this decision, and why? Because I have to assume that is very much an outlier.
It is uncommon. I made the decision when I was actually applying to residency programs. So I pursued the research track at
Mm.
my residency program, UT Southwestern. And my original goal was to be a researcher, specifically in depression. Um, yeah. So, my interest has always been in advancing the science or producing things that are useful and scalable, not necessarily day-to-day clinical work.
Yeah. During your residency, again, based on our conversation, you shared with me that you spent many hours working at an opioid treatment program, OTP. What did you see and experience there that inspired you to found Sonora Health?
Yeah, so I worked at the VA's opioid treatment program here in Dallas, Texas, I think for about a month during my residency training. And it was the only practice setting where patients were required to go to the clinic every day to take a medicine in front of the care team. And so that medicine is methadone. And methadone is of course super important for people who have fentanyl addiction. It's probably the most effective medication we have. And so these patients that I was treating in residency were dropping out of treatment for seemingly healthy reasons. This requirement to come in every day made it difficult for them to keep their job, take care of their kids, pursue educational goals. And I would talk with the attending physician, about giving these patients take homes because it's legally feasible. In many instances, I would say most instances actually, I was unsuccessful in convincing the attending physician to actually trust the patient. And so that's really what inspired this interest in figuring out a way to, give patients the opportunity to show the provider they're doing what they need to do to meet their recovery goals faster and get more take homes.
So, how precisely does Sonora work? What's the process?
The standard process for a patient, I think, is probably best to review, and then we'll go into Sonara. So without Sonara, a patient comes to the clinic, they're given a liquid medication in a plastic bottle. I actually don't have one on my desk right now. And they drink this medication in front of the treatment team. Often they have to wait in line for minutes to hours to receive this medication. As the patient, is in treatment for a certain amount of time and meets certain recovery milestones, the treatment team will give them take homes. Say they don't have to come in every day. They might get, three take homes at a time. So they'll come in twice a week, for example. And they would just take the other two at home. What Sonara does is we give patients the opportunity to really build that trust much more quickly. So if a patient is receiving a Sonara-enabled methadone dose, they'll get a methadone bottle. It'll have a special QR code on it. They'll go to, when they get home, they go to Sonara.app, they log in, and their phone, it will ask them to scan the methadone bottle, and then, they'll record themselves taking the medication. Nothing is actually stored on the patient's phone. It's all streamed to our cloud database for the provider to review asynchronously. So you don't have to like worry about like aligning your availability with the provider's availability. You take the medicine, when you feel it's most convenient for you. And then, of course, as the patient does this, the need to record decreases, and eventually patients pretty quickly usually are no longer recording medication at all. They've earned fully unmonitored take homes. So on average, our patients have about twice the number of take homes compared to someone who's not on Sonara but has been in treatment for a similar amount of time.
How many states is Sonora currently in? How many clinics do you presently have relationships with?
We're in 13 states, I believe, 59 clinics, 50 currently active, and eight to nine that we're implementing actively as well. So,
What are your plans going forward for the rest of the year as far as expanding into other states and other clinics?
well, we just expanded into Pennsylvania. There's some really interesting opportunities in Washington we're looking at, but I think the most interesting growth opportunity for us is with payers. So a lot of payers have to pay for rides to and from the clinic. It's called non-emergency medical transportation. And those are super expensive, often, $30 one way. So, a trip for a patient could cost, the Medicaid group, $60 a day. Sonara, of course, greatly reduces that cost, from our top level estimates, 1 month of Sonara, generates close to like a 3 to 4x return on investment. So really, we're hoping to work with payers so that there can be more formal support and like reimbursement for
Mhm.
providers for using our platform, which will then really incentivize the higher quality of care our platform enables and also gives payers a nice savings.
Yeah. What is the adherence rate been thus far?
Our average adherence rate is around 85%. And it's important, like a good way of thinking about adherence is you don't want it to be like 100%. It would be great actually if it was 100%, but that would mean like all patients should get take homes immediately. Everyone's already like, fully able to use opioids responsibly, which unfortunately isn't the case. You wouldn't want it to be too low either, because that would mean that patients are largely too unstable to receive doses of accelerated take-home methadone. So yeah, we're satisfied with our adherence rate. It appears that providers are using our platform appropriately for the most part.
I guess it sort of flows out of that. Do you have any numbers, tip of your fingers, on Sonara's impact on, patient satisfaction? And, clearly there's I'm assuming a correlation between, say, satisfaction and adherence rate. I guess would retention technically be synonymous with adherence?
Not necessarily. Things that are predictive of retention are patient satisfaction, though, and like the difficulty in getting to a clinic or staying in treatment, reducing that as much as possible improves retention. Um, Anecdotally, our retention seems to be improved by 15 to 20% over a 90-day period compared to patients without Sonara. It's hard for us to get a really good measure on that because we don't have access to the patients who aren't on Sonara. Um,
Mm,
yeah.
yeah. So, give our listeners an idea how you came to start working with Chestnut Lighthouse Institute.
Yeah, so I mean, it's a good question. So we're working with Chestnut and Lighthouse to actually answer some of the questions that you just brought up. So, we have really strong reason to believe that Sonara will improve retention and, enable a new kind of fundamentally new approach to how these providers meet the patient's needs. But we need a research group like Chestnut, and someone who is connected on the payer side, which Chestnut is very much connected there. So to really assess these questions in a robust manner.
Yeah, it's very consistent with their whole go where the patient is approach, because
Exactly.
that is, sort of like in telecommunications, they talk about the last mile problem. It's almost like the last mile problem in treatment, right?
Hmm.
Just getting it there, the logistics. So if you
Yeah,
can,
the last mile problem is really felt, I think, in this
yes,
space. Yeah.
yes,
Because like the
yes.
medicine works extremely well. Um, but there's a couple of last mile problems, right? So you actually have like the difficulty of getting to the clinic, but then like the patient actually receiving the medication. But you also, I don't know if it's a last mile problem, but you also have like outdated prescribing practices. Um, and that's, another thing that our platform's hoping to solve. A lot of clinics haven't really had the freedom to operate in a more clinically focused manner because the regulations were so controlling up until very recently.
Is there any issues, speaking of that, any issue with technology integration with some of these clinics?
No, the technology is super easy to use. We went out of our way to make it so everything works on a web browser. Patient side of things works, on a web browser within your cell phone, and then the clinician side of things, all clinics have Internet Explorer, Chrome, or Safari. So they just log in, to our website, and they're able to, facilitate remotely observed dosing with methadone.
Yeah, no, that's a smart approach. You can go crazy developing on each platform specifically for that platform, and obviously, broad accessibility is the coin of the realm. So we go. So this whole idea of going where people are, just lowering those barriers. When we spoke, you mentioned the highly consolidated nature of opioid treatment programs in the U.S. What challenges does that pose to Sonora Health and your business model?
It doesn't pose challenges necessarily to the business model. It just changes our sales strategy, right? So I think we have all but one of the very biggest opioid treatment programs under contract. So, a lot of our efforts are spent on growing within these current contracts. Um, we also, of course, are spending efforts on growing outside of these contracts, but it changes the nature of how you grow and how you spend your sales efforts. Really going deep with the current relationships that you have is probably the best approach in our situation.
Yeah, you have a pretty decent staff. I was on your site. How many people you have
11.
working? 11?
Mhm.
Yeah, no, but it looked like a really strong cross section of people. So, no, that was very impressive. Um, as a healthcare entrepreneur, what are the one or two things you learned along the way that you wish you knew at the outset?
I never thought of myself as a business person or entrepreneur. I just was kind of looking at things one step at a time. And eventually, one of those steps involved just starting a company so that I could gather resources to build this idea that we had. So really, like, I don't know, I didn't know anything. So if I had known something at all going in, that would have been great.
So
Um,
something more than nothing. Okay.
yeah, yeah. Oh, I mean,
Well,
the things that I learned, the importance of a good team. I mean, like, you could intuitively know that's important, but you really don't appreciate it until you experience it. And, I attribute all of the success after I started the company to the team that I have. So, um, that's certainly something that I've learned.
anything else as far as just growing the business and acquiring new skills, marketing, for instance, looking at a balance sheet. I mean, what are the things, is any major milestone or any kind of revelation or crossing the Rubicon, any metaphor you could think of, that you felt like, yeah, you know what, I now acquired what I need to know, or is it a continual process of learning and trying? And as they say in Silicon Valley, go fast and break things. Although I don't think in this field you can do that.
No, I wish you could go fast. Yeah, no. I mean, I'm still in the process of learning. That's the thing. Like it's probably in my nature to be curious and to always try to learn new things. It's why I became a physician. I had to perform academically. So I don't ever feel like I've like, you know, got to a point where I'm satisfied and am just operating comfortably with the knowledge that I have, not seeking to acquire more knowledge. So I don't know if that kind of answers your question. Maybe not really.
Yeah, no, I understand it. And, I think that it's fair to say, I mean, work with a lot of companies, they want to put out a mission statement or a statement of principles and so forth. But, you know, this seems like a real mission. It's something, you wanted to do and started when you were doing your residency. And I know it's not an easy thing to do. You have very little limited time to do anything during the residency period. So it had to have been, seeing a problem and having a passion and powering through a lot of stuff to figure out what you needed to do to get this thing up and running.
Yeah, and I don't know, like the company mottos or, be kind, be curious. I don't know, that's kind of directed all of our decisions so far, and it's been an effective way to solve problems, right? Um,
Has any of
and
your background as a psychiatrist been helpful to you as an entrepreneur and a CEO?
Probably, yes, it's helped me certainly with negotiations sometimes.
Can it become a
Helping.
problem if you're too empathetic in business and you sort of become paralyzed because you see the other person's point of view
That's
and
a really
feel
good
it so
question.
deeply?
Yeah, definitely, right? It's a strength, but it's also definitely a weakness sometimes. So my approach to manage kind of the downsides of it is to surround myself with people who don't necessarily have as much empathy, right? And
Right,
seek their
right.
advice on things, but totally. Um,
Yes.
yeah, if you buy into what someone else is saying too much, right, you can potentially be exploited. So totally.
Right. So good cop, bad cop works in business. Everybody needs
Exactly.
their
We have a
henchman.
bad cop. He's very helpful. I think we have a
Y-
couple bad cops, so
Yeah. Yeah. Well, that's
they're
probably
necessary cops. So
necessary cops. Yes,
yeah.
exactly. Last question, and I kind of have a hunch I know the answer to this. Do you ever have any regrets that you didn't pursue a traditional career path after your
Not yet.
residency?
No,
Not yet.
not yet. No. This is really cool. I mean, it's not at all what I was expecting when I started residency. I was expecting to do research. So, I was never expected to be my own business person and be the CEO of a company. But it's been a pleasant surprise. It's very satisfying. So yeah, no
Yeah,
regrets at
no,
all.
I could imagine, and to an extent, you're using the same parts of your brain on pulling this all together. So
Yeah, the problem with you are using the same parts of the brain as you would as a researcher. The challenge with research is like, maybe you'll write like a paper and the best scientists might actually get to see one or two of their papers actually change how medicine is practiced within the course of their lifetime. And I'm just too impatient for that. Um, and
yeah,
so
no, that's
it
also
scratches the same itch, but I get, kind of more immediate gratification as a entrepreneur.
no, that's also where Sonara sort of dovetails with Chestnut and Lighthouse. They don't have just the research side of the house; they have the implementation scientists, and they get out there. And that's what's been really eye-opening about conversations I've been having on this podcast, about taking the research and the process of figuring out what does and doesn't survive contact with reality and the process of calibrating and recalibrating. It's interesting.
Yeah, it is interesting. And, the way our study is funded is through the NIH Small Business Innovation Research Grant, SBIR grant. And that is kind of a more interesting line of research, right? Because it's encouraging entrepreneurs to solve big problems and potentially get a big reward. And so, research programs like that are really cool, and I think are an important part of uh, America's success and innovation so far.
Well, Michael, I really do appreciate you spending the time with me today. Great conversation.
Likewise, Charles.
Today, I spoke with Dr. Michael Giles, licensed psychiatrist who founded Sonara Health during his residency at UT Southwestern Medical Center. Sonara is committed to facilitating humanized, compassionate, and trustworthy interactions between opioid treatment program patients and providers via a remote dosing solution that makes it easier for people with opioid use disorder to commit to their methadone treatment programs so they can get their lives back. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.